Welcome to the Beauty Beyond Bella podcast. I'm your host, Dr. Yvette Suarez, owner and medical director of Bella Excellence, a diamond accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests.
Okay, so today we have the most beautiful Natalie Eiland. And, I love bringing people on that have these inspirational stories. I think we forget that life is not always easy and we have to go through all these little seasons of our life to get where we want. And so it's really important for you to know that everyone has these. And looking at these beautiful people, I think that you would look and think that life is easy. I think we all make that mistake. And so I wanted to bring her here so that we can kind of go through her journey and really help others out there.
Well, thank you. Thank you so much for having me.
Thank you. Though I'd love for you to kind of start and tell me, I was so impressed by your story. I know we've seen you for years here, but I want to know what brought you in.
So initially, I'm 28 now, so I think I might have been 17, 18 years old. I started getting acne. At the time, it was just your typical, I'm a 17-year-old girl. Of course, it's going to happen. And then as the years went on and time went on, it became so much worse. It wasn't just a little pimple here and there. It was that hormonal cystic acne that just, no matter what I did or didn't do, it never budged. So I started coming into Bella to get facials, PRP treatments, microneedling at the age of, I might have been 21, almost 22. So around that time frame. And that really opened me up into the whole beauty industry as a whole, because I saw it work. And then not only did my skin clear, but my mind clear, my mental state clear. I felt better about myself. I felt pretty again. Because, acne is, especially for a young girl, it's such I'm going to say traumatic, because it really is. It's such a traumatic thing. I mean, it's your face. You're looking in the mirror and you're seeing something that shouldn't be there. And no matter what you did, or like I said earlier, didn't do, it wasn't budging. It didn't work. Nothing worked. It was a hard thing. Oh my gosh, absolutely. And, that's when you're starting to go on dates and, go to parties as a kid. And I was getting ready to go to college and be in a sorority. And it was definitely something I always felt like I needed to hide. I was hiding myself. I never wanted anyone to see me without concealer or foundation on. And then even if I did have it on, you could still see it because of how bad it was. And then, you have friends and family members. Even I have an older sister who she never had a blemish on her face her entire life. So it's like, what am I doing wrong? Why me? So it was definitely something that took a toll on me, mentally, more than anything. So once I started all of my treatments here and I saw things work, it definitely was just an absolute game changer for me.
And that's a little late. So if you think about it, even we see a lot of teenagers coming in even as early as 13, right? Both boys and girls, as they go through that wonderful hormonal changes that they go through. Right, they can start really early. And I love that, even though we started a little later in your treatment, we really need to get them before they become scarred. And I think that's really hard. I try to explain to our patients, and it does, and it breaks my heart when I'm somewhere and I see these 15-year-olds walking around with really bad cystic acne, because we know that if we treat it early and we can prevent the scarring, so long term it's going to be much better. Once they go into the scarring phase and they scar the dermal plane up to our skin, much harder, right? Correct. A lot more PCOS, a lot more microneedling to try to reverse that. And I think that's really hard. So yours started a little bit later. I think it's a little bit different than you had other things that were triggering your acne.
Oh yes, many things that were triggering acne. So at the time I initially began having my acne, I was 17, 18 years old. I remember I was at Florida Gulf Coast. That's where I first went to college. And my acne was at its absolute worst, but so was my health. I've always suffered from a bad stomach. It's in my genes, it's my DNA, but it's worse when I was about 18, 19 years old. lo and behold, I had celiac disease. I never knew it. All my life, I had my regular appointments and everything. It was always, you IBS, or it's this or it's that. you have this sensitivity to this type of fried food, whatever, but it was never celiac disease. And then I consider that to be pretty late in life. Yeah, I was only 18, but I mean, to have an absolute turn of events in your lifestyle and everything's changing at 18 years old, I mean, it was crazy. I was diagnosed with celiac disease, and the foods that I was consuming, not knowing that not only were they damaging my body and my gut and making me violently sick, it was contributing to my skin health. And now that I'm in the medical field myself, I understand that everything first is going to show on your skin. And then not only was I diagnosed with celiac disease, but I also have PCOS and endometriosis. And I know that contributes a big portion to your skin as well, especially the hormonal side, those deep cystic pimples, and trying to get, like you said, the scarring and get rid of those. It's not easy. It's not just like washing your face with salicylic acid comes there and getting rid of the white ash. And so, but yeah, I wish it was that simple. But even when you control the cystic breakouts, it's, again, a whole process and getting rid of the aftermath, which is a scar. And then that's what mostly you all had done, Tyne itself. That's what Bella did for me. They got rid of those deep scarring that I was like, okay, the acne's gone, but now I put makeup on and it's like I had indentations in my skin. Like, who can I ever win? And that was, it all itself has been like the, if I want to use journey, I feel like journeys should be a confident, right? But it is definitely tough, and it's something that I wholeheartedly believe in. And I mean, at the end of the day, I feel that God will save me, really. It saved my face.
Look, we know acne. Acne is so hard. It's interesting. You talk about knowing and learning about all these diagnoses at such an early age, and I can almost see it being twofold for you. I mean, that overwhelming that you can get all these different diagnoses, and now you have to learn about PCOS, and you have to learn about endometriosis, and you have to learn. And then, at the same token, it must be rewarding to find a reason that it's not IBS, and it's not that you drank a soda and your sister told that. Now you had me also issue. I had some extra spinal.
I knew how to treat complaint. I knew how to treat it. And that's something that, it's the gluten thing, obviously. That's very easy to avoid because of how awful it's more than just like, my skin flares. I'm not just like gluten intolerant. Like, I had celiac disease. Like, I have it. I'm sick for days, and it's not fun, and it's an unbearable type of pain I wouldn't honestly wish on my worst enemy. But I know how to treat the other things, like my PCOS, my endometriosis, or just simply the fact that I probably do have very sensitive skin, and there's certain products I can't use and treatments that I need to continue on with, and I've dedicated myself to that, and it's been night and day for me. Night and day.
God bless you for that. And celiac, I shouldn't have gluten. I have gluten. But Natalie, you can have it. It's actually much work to it is trying to avoid it. And I agree with you. Thank you for making me feel sick. You would totally stop it around when it doesn't make you feel sick. You're right that it's not great for you. Look, Miss Country, unfortunately, our gluten content in our food is astronomically high. So even people that are just a little sensitive to it, and here we have that versus if we were in Europe. Correct. The gluten is very different there, that it's very natural and we can have it. And I agree, my son is gluten sensitive, not celiac. Okay. And when we go to Portugal and Italy, he loves eating all the pasta he can eat. He doesn't tend to break out. So that's amazing. Yeah, very different for celiac. Once you have that enzyme, right, you really need to take a step back, right? I feel like it's also becoming a lot more popular.
Oh my goodness, and a lot trend at this point.
It's like a trend now. What advice would you give people out there that maybe are being diagnosed with IBS or having some insensitivities but really are not getting better? How did you know to keep getting an answer?
Well, I mean, you have to be your own advocate. You have to. You have to be your own health advocate. And I know that's maybe an oversaturated term now that goes through one ear, not the other for many people, but it is the truth. I work in healthcare. I'm a nurse. I see it every day. You have to be your own advocate. It was to the point where I wasn't getting answers, and I also wasn't feeling better. And when you don't feel better, you don't really care if a doctor's like, oh, she's back again, or if, you're going somewhere else and it's an hour long away because that's somebody that was recommended to you. Like, you don't care when you don't feel well. You don't care. So just continue to push, continue to be our advocate. And I mean, I'm not going to sit here and act like I was in denial when I first was diagnosed. I was like, at first I didn't know gluten was. So we need gluten, what's gluten? And then it got to the point where I was like, you know what, this is too tough. Everything I'm eating doesn't taste good. Screw it. But there's no way it can be this. I'm 18 years old. I've had it my whole life. And I continue to have it. I continue to get super sick. And I'll never forget it. My doctor actually looked right at me. He goes, are you trying to put yourself into shock? Stop eating it. I'm like, okay. And eventually I stopped. So it's with sticking with that plan. Stick through it. It's tough. Whether it's gluten, lactose intolerance, whatever. Stick to it. It's going to be like a habit. Eventually when you break it, it's smooth sailing. Just trust and just stick to the plan. And don't break that stride, because it's all about repetition and you'll get used to it. Trust me, like a bread basket comes to the dinner table now and it doesn't even faze me. I still till this day, and some uncles and friends who are like, I'm sorry, do you mind if I eat this? I'm like, trust me, I don't care. It doesn't bother me. It's just part of my life now. It's just a normal.
And look, and having it would make you feel miserable for days. It's not hours.
It's not worth it. It's not worth it at all. I'd rather never touch gluten again in my life, But it's also been like a blessing and a curse for me, because it's made me, I don't think I would have never considered myself to have been overweight. I was never obese by any means, but I definitely had quite a few extra pounds on me that I didn't need to have. And it's kept me in check. It's not only helped my health, but it's helped me to appreciate being aware of what I'm putting in my body, or how I'm treating my body, or how I'm talking to myself. It made me shed all of that extra weight, and I realized, I feel better about myself, now that I'm slimmer and I can wear this shirt and not feel weird about it, or I'm not, sucking my stomach in every time somebody takes a picture of me. And again, I know men struggle with this as well, but especially as a young female, as a young girl, going through those stages in your life, that's something that, and I know whether you have allergies or autoimmune disease or anything, it doesn't matter. Girls are going to experience that. That's just the nature of womanhood, being the beast, of the beast. But it's something that has made me appreciate the level of health I have now, of being better. And it's, I take my fitness very seriously. That's not because, I'm not happy with myself, but I don't think there's anything wrong with wanting to, look good and feel good about yourself. There's nothing wrong with that. And I know a lot of people who, I don't want to say shame, but they do. They shame specifically women for, she has to go, to the gym 4 times a week, or, she, likes to get her Botox. It's like, so what's wrong with that? Like, what's wrong with doing things to make you feel beautiful about yourself? Because at the end of the day, if you don't feel good about yourself, you're not going to treat yourself, kindly, but how are you going to accept and be kind to other people? It doesn't work that way. And I noticed that in me. I was in that dark place about feeling good about myself because I didn't look good and I didn't feel good, physically. So it affected me mentally, and it's a total game changer. I don't think people that necessarily have gone through things similar to me or things just like me understand that. And again, for girls are catty. Girls are, not all of us, but a good amount. But in depth, I gotten better. Yes, my generation, it was a secret to get Botox. Oh, was it? Okay, secret, okay. I can see that, and still some women that are older than me, they get out their husbands to know they get it done. I always think that's really cute that they're 50, they have no wrinkles, and their husbands have no clue. They all have it now. And I'm like, how do you even get away with that? They tell them they're going to go to squatting in a facial. Really, they're coming back with little needle pricks all over their face. They don't even know. They tell them that Ray have a magic cream that takes away all the wrinkle. I just have to tell you, there's no magic cream out there that have away a wrinkle. No, they start always saying the same thing, like L'Oreal or something. But I'm like, it does work. You're like, gosh, it's amazing. Yeah, it's a miracle drug.
But I feel like your generation is a little bit better, even though, look, I still see shaming. However, you guys believe in a lot of prevention now. You guys, you even prevented those lines from getting really deep. You guys prevent on, using skincare. And right, you love to see them using just sunscreen.
I know.
And they're using vitamin C early and grace backers early.
Right.
You guys have exosomes. I mean, you have so many things that we never had that we had to keep in a little bucket. I feel like you guys are the forefront. And it is a shame still that people, look, sometimes I think it's upon within ourselves, right? When we're not happy with ourselves, you'll find those the people that begin to shame.
Correct.
And so I kind of take that step back and do a positivity thing with them and going, it's okay for you to feel like that.
Right.
And then we need to look within ourselves. And like you said, it's okay. And
There's nothing wrong with it.
we don't hide what we do, but there's all many of people that hide it. And I think when we stop hiding it and just letting them know that we can look really natural and have everything done, and there should be
No judging, none, not at all. I totally agree. Absolutely. And that's the thing too. It's like with people my age, girls my age, I think that social media has played a huge role in people accepting it. I mean, you go on TikTok now, it's like, it's Christmas time right now, right? You see like the trend about making your own Christmas list. Yeah, it's like Botox money. It's like girls buy it. It's like, it's just such a common thing now. And I think that that's also made people like more accepting of it and say like, okay, this is okay. Like, it's not something that needs to be like, that's what I read, right. And like you said as well, there is, I know, men too, absolutely. And it's like, it's one of those things that's now I feel has become so common, like amongst having conversations about it, that it's not something that is shamed anymore. And it's more of just like an open thing. So.
And I love that you brought up nutrition, because, you know, that's one of our pillars is nutrition. And I will say, when you look at celiac patients, they really do look really slim and well.
How is? And let me tell you, now the object got up, but now they have made so much more stuff. I'm like, oh my God, like, if anything, it's going to make you gain weight. Oh, rather lose. Oh my gosh, you name it. They have brownings and cookies and bread that tastes decent again, rather than just like sandy cardboard. But you are correct. It's definitely a lot more healthier than ever be able to have whatever.
Well, look, at least you can go to the fast food restaurants, right? There's certain things, and I think why our country has obesity is because of all of our, you know, fast food, and we're all complicit. Look, sometimes when I'm with my kids and I have to hurry up and get something, it's much easier to go get Chick-fil-A than to go to sit down for a restaurant for an hour instead of time to eat healthier, right? But there's so many better healthy choices.
Oh, now, so many. And it's just about, I feel like me, because I have celiac, just simply going somewhere to eat, it's work. You know, I have to see if they have options for me. I have to see if maybe a place I'm not too sure about has any reviews of like, no, like they glutened me here, don't do it. Because I have my fair share of those experiences too, and that scars you. And going to the grocery store to shop, it's like you're walking the aisles or you're reading for forever, or you're trying to find where it says gluten-free on the box, and it's a pain in the neck, but you do what you gotta do. So I agree. Convenience is out the window. No, for me, but you know, I agree. You make it work. I agree.
You make it also get you a little, I tell my son he always has expensive taste, and he says it's because he's gluten-free, so he needs steak and lobster and potatoes. And I'm like, okay, you can't be like every other kid, right?
Yeah, I understand. That's okay.
I understand.
That's okay.
So let's talk about a little PCOS. I think a lot of people know what it is, right? So polycystic ovarian syndrome. I think when we think of that, we think of people that could potentially have endometriosis, heavy bleeding, more hair, right? Darker hair, needing laser hair removal, lots of other things. Looking at you, right? Most people wouldn't say you had PCOS. So how did that conversation go?
So exactly like that. It was something that I was not diagnosed for a long time, and it got worse and worse. And eventually my OB looked at me and was like, hey, what are you doing tomorrow? Because we're going to do surgery on you. So it was definitely something that was scary. I was known. It took me by surprise at the time. I didn't know what it was either. But what happened was, it was the summer of, oh man, it might have been around the same time with the whole celiac, been 21, 22 years old. It was a rough year. Right. Oh my gosh. All the things. It could have been later on again. There's been a lot going on clearly in that time frame. But so it was like 6-7 months. Didn't get a period again. I did not have a period. And I was a runner at the time. I figured, okay, like it's just normal. That's what happens. No body weight. Right. I know that girls at school, dude, they stick periods all the time. Like, it's no big deal. Like, I wasn't really concerned about it. And it was nice to not get one. Let's be honest. It was very nice. But I was also bloating a lot. I contributed it all to my tummy, my celiac. But again, wasn't eating gluten. So it was like, I wonder why. Maybe I'm, ingesting too much protein. Because again, I was very new and into fitness at the time. So I thought I was just doing things not correctly. I was still learning. But then I started getting this really bad pain. Almost felt like a muscle spasm tripled. Like this pulling in my side to the point, like I couldn't even, and I have a pretty high pain tolerance. But it was like I couldn't even take a deep breath without like taking a minute because it hurt. It always hurt.
The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com.
So I went to the OB. They did a ultrasound on me and they found a cyst. Again, that's very common. That happens all the time. They'll go away with your periods. I'm like, okay, but I haven't had a period for 6 to 7 months. Like, it's not going wet. So they gave you the pills that would try to reduce the period. They tried birth control methods, and then it turned into, we'll just watch it. We'll just watch it. Well, they were watching it for far too long. And then I ended up going to my mom's OB, who I absolutely love. She saved me, really. Saved my ovary. But I still go to her to this day. But I went to an appointment with her. She did the ultrasound, and she was like, whoa. Like, this is massive. I had a cyst the size of, I think they said like the size of a little bit over a golf ball on one of my ovaries. And I'll never forget it. I was going to be the maid of honor at my cousin's wedding like 2 or 3 days later. And she came back in the room and she was like, hey, what are you doing tomorrow? Because I hope it's something. And if there is, cancel it because we're doing surgery on you. And so she did that. And then I got the laparoscopic surgery. And while she was in there, she found an abundance of endometriosis all throughout. And it got to the point where I was diagnosed with that. And I have not had, I have not had any cysts to that magnitude. But, when you have it, you feel them pass, and it's painful still, but at least they pass. I'm on more of a normal ovulation schedule and everything like that now. But at the time, it was just one of the, this is normal. This is what happens to women. And I feel like the more I learn about it and the more I talk to other girls, it's like, whoa, why is it always such a conversation of, this is normal, you're fine. Oh, it's just normal, you're fine. It's like, not really. I almost lost my ovaries because of this. And they diagnosed me with PCOS, and that explained all my bloating, and the endometriosis played a role in that. And that was one of those things that I never would have found out unless what hit the fan. But luckily it didn't, because my doctor saved that from happening. But you were a cell advocate, right?
Yes, we're about that conversation. Something's off, something's not right. Amenorrhea or loss of periods is not normal unless you're pregnant. So definitely not my case. You saw that putting your pregnancy test on. Oh God, it's not that.
No, honestly, that was the thing at the time. I was like, there's no way that's it. Like, I was gone, and it was always one of those things that was never like a thought in my mind, because I knew it couldn't have been that. I knew that I was running a lot, and it was just one of those things that even I kind of pushed under the rug until the pain started getting to the point where I couldn't bear it anymore. And even my mom would look at me like, what's wrong with you? I'm like, hold on. She's like, can you breathe? I'm like, yeah, but like, I can't right now. Because it was just one of those weird things where it's like, if you took a deep breath, it was like it skirt more. It was just weird. It was a very weird, strange feeling. That's why I know when I'm passing now that that's what's happening, because I can feel that and I can correlate that pain to what I had been used to before.
And nobody knows about the side effects, right? So you start thinking about those increased cysts. You could have hemorrhagic cysts, which bleed into it. Those are extremely painful or normally have to go get corrected in surgery. The scar tissue that all the cysts can cause, the endometriosis can cause infertility, right? So for these beautiful young ladies, if we can catch that early on and not have to deal with infertility and other things, I think that's really important. And I think, we have a lot of problems with infertility in this country. We do.
And I think we need to take a step back and really look at these younger ladies and maybe diagnose them a little bit aggressively. Absolutely. And really get to the core problem, not just write it off as, oh, this is normal. This happens to everyone. Well, if it's so normal, why is it causing me pain? If it's so normal, why haven't I gotten a period in 6 to 7 months? That's not normal. And even me before, that was before I was even in the healthcare field or had the thought of even going into that line of work. I knew that wasn't normal. Everyone knew that wasn't normal. So it was just, and I don't want to bash, healthcare providers or anything. My goodness, I'm in healthcare myself. But again, that goes back to my point earlier of you have to be your own advocate and don't have any shame in going to a different provider or, it might be a pain in the neck, but you might have to drive a little bit further to go to your doctor's appointments because that's the doctor that will work with you or that's the clinic that will help you. It's just all about convenience kind of goes out the window.
Right. Look, you went and trained to be an RN. You went into the field thinking you were going to go in aesthetics, right? But we never know. I went into the ER and into start somewhere, right? You don't know where we're going to end. I'm right. I think God kind of puts this path in front of us, and so we need to keep leading that. But having that background, right, gave you a lot of empathy towards your patients, big time. Counseling them on being self-advocates, and again, we should not, as physicians, take it as a hit to us. No, we really should not. Everyone's going to practice a little bit differently, and we want our patients to find a provider that believes in what they believe in.
Right.
And I struggled with the same thing. When in my cancer diagnosis, I couldn't find a provider that believes that there was wellness and alternative medicine with traditional medicine.
Absolutely.
So finding that, I think that's in every case. We need to find a physician that can align with what our beliefs are, right? Doing no harm, right? And no matter what we treat the problem, but there's many, many ways. And I'm hoping, as most of us and a lot of us now go back in and do a fellowship in anti-aging and wellness and metabolic medicine, we need to continue to push that envelope that other physicians and providers keep doing that. And if not, we need to keep finding people that believe in that because it can't only just be traditional medicine. It has to be.
No, and especially, just reviewing healthcare, it's always evolving. You learn something new every day. You could know it all, but guess what? There's going to be one thing at least that you don't know. You're going to always learn. Things are always going to evolve. There may be old ways that become the new way again. And it's just one of those things that you have to just always keep an open mind about. Healthcare providers, they're very educated, but we're still human beings as well. You know what I mean? We can't read your mind. We can't jump in your body and feel what you're feeling. So you have to be open and honest as well. And I feel it for a while. And again, I was a young girl. I was scared. There was a lot that I, wasn't really being honest about. Like, oh, do you have pain? Yeah, I do. But it's like, no, tell them you have excruciating pain. That kind of thing. Tell them that, you are bloated, even if it's once in a while. And because, you might have a doctor that would look at you and then well, of course you were, We all eat things that bloat you sometimes that you kind of feel, dumb. But again, going back to, I don't want to bash doctors, but they may not have meant it in that way to, silence you. But again, I was a young girl. I was something that I, was like, okay, maybe that is, you kind of feel silly. But again, be your own advocate, push for it. It's one of those things that you have to use your voice because they can't make your mind. No.
Listen, I agree with you. Being open to the provider. Unfortunately, with traditional medicine now, I think, and I feel bad for physicians that are practicing this way out in ladders, they have a 10-minute window, right? If you have people. And it gets really hard. Look, at that point, we want to make sure you're not dying, you're healthy, right? Stay-able's good. It's terrible, right? Stay-able good. That was the thing.
Yeah.
Treat them, making sure everybody is great. It is not, how can we make them well? How can we make them optimize on all of their levels? We don't really practice like that in our healthcare. That's something that I think you have to do outside, unfortunately. And I think maybe in time that will change. I think little by little that's starting to change. But like you said, you need to say, I want to feel 30 for me, 30 for the rest of my life. For you want to feel 20 for the rest of your life. But absolutely, how will we continuously feel that way, right? So we look at all of those aspects. And I can see that in your family.
Yeah.
Your family's all really cute. I know a couple of them. And I love that you guys do this journey together.
Of course, it's fun, and and it's again, it's fun. Yeah, you're a bunch, girls, my mom, my sister, but it's more than that. It's like it's what makes you feel good. It's what makes you feel beautiful, and it's there's no shame in it. There's no shame in it at all. It's something that my sister actually, I kind of call it like the wolf pack. She's the one that started with aesthetics. I started with skincare, but the Botox, filler, that kind of thing, that was all my sister. She started with that. And I was one of those people too, I'll admit it, like, oh, you don't need that, or oh God, you're one of them, blah, blah, blah. And then I got a little bit older. I started seeing my forehead move a little bit. I started seeing my frown lines. I saw, my lip kind of turn in a bit. Like it didn't look like that a few years ago. And I'm just like, okay, maybe I will do this. Maybe I will have a bit of consultation. And then it's like, I don't have any tattoos, but I know once you get one, you can't stop. It's like I was sucked right in. It's like, okay, be over. Thanks to Holy. You did it, and the calm jumped in, and it was a trend for all of us to kind of fall into Paul's path, and we did. And it's something that I don't think any of us will ever add.
Well, look, they are both so precious. Thank you. I look at them, and obviously I'm a little biased. I think they look gorgeous. I think they look super natural. Yeah, they say look really healthy. Right. And, your mom is like, my age, and she looks great. Man, she told me a little funny story that for Christmas, she always knows that the one gift that she has to get a gift card to collector. That's all you want. The older you get, it's like the toy things out the window. You have enough clothes. You can buy your own clothes now, whenever. Now it's just like birthdays, Christmas, whatever. It's like without even hesitation. It's like, so what do you guys want this year? And you just kind of look at each other like, you know what we want. Everybody here knows what everyone wants. So it just all turns into they'll gift cards. I love her happy as a plan with it. That's all you want. So we did talk. So we have 4 pillars. And our first pillar is aesthetics, which we talked about. Wellness, which we talked about. Nutrition, which we talked about. The next one is, we talk about brain performance or mental clarity, mental well-being. How does that fit in your life? Because, especially being an RN, that's kind of a difficult field. You see a lot. How do you save your mental well-being?
Right. So I think my mental well-being is something that started long before I was even in healthcare. Again, it went back to my acne, my, bloating, my weight gain. And it was something that made me not feel good. I didn't feel good about myself. I didn't feel pretty. And that was something. And I've always also been just a very anxious, nervous girl. Always have been. I don't know if that's like a DNA thing about me. I have a wonderful family. I have a great life. So it's like, you kind of like, why do I have this? But again, some of us just have it. And that was something that I always did struggle with. I did, even as a young adult. And there's some days now that I even still struggle with it. But especially being in healthcare, it's a different type of world. You see a lot of things that you never thought you would see before. I work with children. I'm a NICU nurse, so I work with little itty bitty babies. And I also, work with women. We're having babies, going through it. I see pediatric sides of things. I see children, and there's just a lot you see. Even when I was just a student at clinicals working with adults, there's a lot you see that you're like, okay, this feels like Grey's Anatomy. Things you were like, oh, that doesn't happen. That's not real. It's like, yeah, it is. You see a lot. So it's definitely been quite the twist of events, I could maybe say. It's like, it wasn't about me now, it was about them. It was about being in the right frame of mind for a total stranger, because they're relying on you, and it was something that took a bit of, figuring it out. There's nights where, I come home from school, like, oh my gosh, can I do this? Like, I don't know if I can continue on with seeing things that I saw today or feeling the way that I do, but it's something that I think having the experience of having the past, of having to get into the right headspace and knowing, steps 1, 2, and 3 have gotten me okay with that, had helped me been like, okay, I've done this once before for different things. I know how to do this again in the healthcare world. So I'm a woman of faith. I take my faith very seriously. I always pray, even when I'm working with little itty bitty babies and, I'm standing there changing their diapers, I might in my mind say a little prayer over them. And I pray for me at night too, like give me the strength and give me the clarity. That way I can care for these people as well. Because if I'm not right, how in the world am I going to be there for someone else? So it's a lot of that. It's a lot of making sure I'm healthy. I'm taking care of myself. Again, I'm very into fitness. I do Pure Barre and I fully believe in it. And that's something that I'm going to have to come back to. Yeah, you are on strike. It's awful, verse, but then you're like, okay, this is a good kind of awful. But or even just going to the gym, for a walk, moving your body, making sure, you're eating healthy, those types of things. It really does. If you feel good here, you're going to feel good here. Because again, I've been through it before I was even in healthcare. I know what it's like to be physically unwell and how that triples into being mentally unwell. So it's a lot of just putting your health first. You might have to say no to another ice cream line, and that stinks, but oh well, because it's more than just, it's gonna make me gain weight. It's like, no, it makes me feel better mentally too. I don't think a lot of people understand that either. And again, it goes back to like the judgment thing, like, oh no, she always has to eat healthy, blah, blah, blah. It's like, yeah, because it helps your mental state. Not everything's about your physical appearance. It's a lot about what's going on upstairs. And it's something that I do take very seriously. I do take my fitness and my nutrition and my health seriously because, again, I know I sound like a broken record, but it helps your mind. And if my mind is clear and in a good place, I can help other people. And I can provide the care that they deserve. And it's something that I know you're not going to walk into work every day being, 100% okay. Life happens, things happen, you're going to have a bad day. But as long as I'm able to recognize that, stop myself and be like, okay, let's do A, B, and C just to get you through the day. Then that's what I get. And there's going to be days where I'm like, okay, you know what? You could feel like crap tomorrow. Today, these people are relying on you. Their lives are in your hands. So suck it up, deal with it, feel like crap on your ride home, feel like it on your day off tomorrow. So it's that is amazing because, just the thing in your mind.
There's not days that we're always full, right?
Right.
And when we're empty, we have to recognize that so that we're not mean to others and know that we will fill ourselves up again so that we can be amazing for other people. But I think people think that they have to be amazing every day, and that becomes very stressful for them. I heard that they have to constantly give when they're empty.
And it does the reverse effect. To make it worse. And I've done that. I've burned myself out before, and it's hard to climb out of that dark hole. It really is. So again, I think having all of those experiences, especially at a young age, as a young girl going through a lot, and just simply experiencing growing pains at the same time you're experiencing all these other things, it was a blessing and a curse. It's something that was tough, don't get me wrong, but I'm thankful for it. I'm glad it happened, and looking back now, I wouldn't change it because it's helped me today. And I think that's I'm sure you understand more than anyone, it's something. You have to take the good out of something, Dad, or else it's all for naught. You have to. And I know it's very hard for many people, if not everyone, to do that all the time, and that's okay, but you have to at least try because there's a silver lining in everything. And I may be naive in saying that, maybe something bad enough hasn't happened yet where I possibly can't, but even if it's just a matter of being hopeful that later on down the road you will find that silver lining, I think even that's something to hold on to.
There aren't terrible things happen in life, and we can't control that. No, we can't. So all we can control is the way we behave and the way we see that.
Right.
And I agree with you, and I pray all the time that God will give me wisdom and grace, right? And that we can continue in health, that we can continue our way. I think when we put too much of that stress on ourselves, we're here for others. I feel like we feel the best if I can make someone smile today, if I can and help them. And I agree with you when you're in the NICU, and I remember because I loved the NICU, I lived long in the Palmer, we had a 100-bed NICU, and I'm up all night putting lines in little babies, and I remember how hard that was for my patients, right, to see their child, and there was, it still makes me tear to this day working in the ER, and I did PDR, so if I lost a child, particularly once I had my own children, to go and tell a family member that I remember after I had a child that once I had to give the most awful news I think a human could ever have is lost a child. And when I had to tell them, I literally had to pause after I told them because they no longer can hear anything you say, right? You cannot. When you go into that shop, and I remember sitting there and I let them cry. I sat there and quietly in tears until they had time to talk to me. And right, I think we need humans like that. I think we are going to have bad things happen in this world, but having amazing people that can sit and hold their hands and walk them through that and give them some grace, I think that's what we need, and that's what
Well, you need more humanity. You need to understand that, yes, even though I have more book smart education, that doesn't make me not so human. That doesn't mean one day you're not gonna, hopefully, but unfortunately, like we said, like happens, you may have to sit there and be on the other end of that and receive use from someone else. And it's important to keep that humanity factor, and you have to and I feel like sometimes that's something that maybe, unfortunately, I don't think necessarily some people can learn that. That's just something you have. That's who you are. That's your character. And I'd hope that everyone could. I know. I've learned most amazing human. I know. But I think that's why it's so important to make sure that it starts with you, because it's like a domino effect. It reflects. I mean, I know if I didn't have the family that I have, that I wouldn't become who I am. And I think that's so important as to why it's so important to take yourself into consideration and really take the steps needed to make you know what's going to make you be a better human as someone else, who it's a ripple effect. It really is. And many more of that.
We did as well for sure. We need to hold our hands and hold our people and give everyone a big hug today.
And but yeah, right. Okay, on a lighter note, I always love, I asked our gallery, no, look, I'm not an emotional girl either, I will say, but there is, because he was up there. That's why now audio,
Just a loss of a child, and there is just to see the suffering and hurt in people, and just to know that sometimes just being quiet in a room is saying it's fair. Just being there for another person really goes amazing.
Right, you're a mother. I'm not a mom. I'm not a mother, yet. One day I hope I am, but I know what it's like to have a mother who loves me with every ounce of her being. And I know that's what I'm going to be like one day, but I know that's a love you don't understand until you are a mother. So that's what helps me to have the empathy and the grace and the strength even for a lot of these parents, and I'm taking care of their child. It's not just like, oh, this kid's crying all day. I was like, okay, but this is somebody else's child, Natalie. Think about it when it's in your, when it be your child, right? I want to be the nurse that I would want someone to be for my child, right?
Yeah, the unconditional love is so real. It's crazy. You sometimes think it could happen, right?
I'm not regretting I've had the babies, but don't rush it out. I can't wait. I feel one day. You're young. Enjoy your life. Yeah, enjoy your time. Right.
Enjoy your new engagement.
Thank you.
Congratulations.
Thank you very much.
I noticed her ring when she came in. I thought, that's beautiful.
Thank you. Yeah, it's my new jewel. Your nitty boo. My new jewel.
So tell me, what does beauty mean to you?
I like that you asked me that, because I think it's more than just what meets the eye. Beauty is more than just an appearance. I think beauty at the end of the day is what you feel. It's a feeling more than something you see. I think it's, the essence of what makes someone or something everything that it is that you appreciate. So I think it's something as simple as the warmth you feel when someone smiles at you and you've had a bad day. I think beauty is something that, is like when you look at a sunset over an ocean and you feel that, like, that peace. It's like that's what makes the sunset beautiful, is what you're feeling from that. And I think it's something that just makes whatever makes someone or something uphold its purpose, that's what's beautiful, is the meaning and the feeling behind what you see.
So well said. I love that. Again, thank you so much for coming.
Ours is fun. Sorry if I did the project. I can't believe this. No, it's all bring a tissue ball. That's okay. That's okay. It's because you're the part. Well, thank you. I'm you.
I love having you here.
Yes.
I will. Please give a big kiss to your family.
I will. I definitely will. Mom said she'll see you tomorrow, but that's the point. Perfect. They come for tomorrow.
Thank you.
Thank you.